Look down at your toes right now. Go ahead, I'll wait. Because what you're about to learn might change the way you look at them every single day for the rest of your life. Somewhere between your brain and the very tips of your toes runs a message system so fine, so delicate, that most people never think about it until something goes wrong. And if you're living with Sjogrens, something may already be going wrong down there. Quietly. Slowly. Without asking your permission. I've spent a long time studying the strange, sneaky way Sjogrens shows up in the body. And of every place this disease likes to hide, the toes might be the most overlooked crime scene of all. Not because the evidence isn't there, but because we've all been trained to explain it away. Cold feet. Just poor circulation. Tingling. Just sat wrong. Numbness. Just getting older. Sound familiar? Before we continue, I built something specifically not for just tracking and doctor's appointment. It is called Sjogren's Ultimate Symptom Map and Diagnostic Action Plan, and it walks you through exactly which symptoms to track not just for Sjogren but also for MS and RI. Drop symptom map in the comment, and I would send the link for you to access it. Here's the thing I need you to sit with for a moment. Peripheral neuropathy, nerve damage in the furthest reaches of your body, almost always starts at the feet before it starts anywhere else. And within the feet, it often starts at the toes first. This isn't random. It's because those nerve fibers are the longest in your entire body, stretching all the way from your spine down to the very tip of your smallest toe. The longest wires fray first. Think about a garden hose. If there's a weak spot anywhere along its length, the very end of the hose is where the water pressure drops first and where you notice the problem before anywhere else. Your nerves work the same way. The tips of your toes are the end of the line. So when Sjogren's inflammation starts quietly interfering with nerve function, the toes are often the first place the signal gets scrambled. Long before you'd ever think to mention it to anyone. Long before it shows up on a standard exam. Long before you'd connect it to your autoimmune disease at all. This is exactly why so many people walk around for years with early nerve involvement that nobody has named yet. Not because it isn't real. Because it hasn't been recognized. Let's talk about why this happens. In plain language, no medical jargon, no complicated diagrams, just the truth in a way that actually makes sense. Sjogren's is your immune system mistakenly treating parts of your own body like a threat. Most people know it targets moisture glands, the eyes, the mouth. But immune inflammation doesn't always stay in its lane. It doesn't read the textbook and decide to behave. In some people, that same misdirected immune activity can affect the small nerve fibers responsible for carrying sensations like touch, temperature, and pain from your feet up to your brain. When those fibers get inflamed or irritated, the messages they carry become distorted. Sometimes too loud, so a light touch feels like too much. Sometimes too quiet, so real touch barely registers at all. And sometimes the message doesn't arrive in a useful way whatsoever. Think of it like a phone line with static. The call still connects, but the message coming through is garbled, delayed, or missing pieces entirely. That's what small nerve fiber involvement can feel like in your toes. It's not that your feet have stopped working. It's that the wiring underneath is sending mixed signals. And here's something most people are never told. This kind of nerve involvement doesn't always show up on the tests people assume would catch it. Standard nerve conduction studies are excellent at detecting damage to larger nerve fibers, but small fiber involvement can be present even when those bigger tests come back looking perfectly normal. This is one of the biggest reasons early small fiber symptoms get dismissed. The tools that would catch bigger nerve problems simply aren't built to catch the subtle whisper of small fiber irritation in its earliest stages. Which means the most important detection tool you actually have access to, every single day, for free, is simply paying attention to your own toes. Let's walk through the early signs together now, one at a time, slowly, the way I'd want someone to walk through them with me if I were the one sitting on the other side of this. Not to frighten you. To help you finally connect dots you may have been staring at for months, maybe years, without realizing they were part of the same picture. Intermittent tingling. That faint pins and needles feeling that comes and goes, especially in the evening or when you're finally sitting still after a long day. It might show up for a few minutes and disappear, then return a few days later. Because it's inconsistent, it's incredibly easy to write off. Have you noticed this while lying in bed at night, right before you fall asleep, when everything else goes quiet and suddenly your toes are the loudest thing in the room? Burning sensations. A warmth or hot, prickling feeling in the toes that has nothing to do with the temperature around you. Some people describe it as their toes feeling sunburned from the inside, or like they've been standing too close to a fire that isn't actually there. This can be one of the more unsettling signs because it feels so specific and so strange that people sometimes worry about mentioning it out loud. Numbness. Patches where touch feels muted, like your toes are wrapped in an invisible layer of gauze that never comes off. Do your toes feel different when you walk barefoot across the kitchen floor compared to how they used to feel years ago? Has the texture of your bath mat started to feel less distinct under your feet than it once did? Toes that feel unusually cold, or strangely warm, without any clear reason tied to the room temperature. Have you stopped noticing the temperature of the floor the way you used to, the way you could once tell instantly if the tile was cold in winter or if the carpet had absorbed some warmth from the sun? Increased sensitivity to touch. Where even bedsheets, socks, or the seam of a shoe feel irritating against the skin, almost like the nerves are overreacting to the smallest input, turning something completely ordinary into something uncomfortable or even painful. Loss of vibration or temperature sensation. This one is subtle and easy to miss because it doesn't hurt at all, which is exactly what makes it dangerous. You simply stop being able to tell if water is warm or cool on your toes in the bath, or you stop feeling the gentle vibration of a washing machine through the floor the way you once did without even thinking about it. Muscle weakness affecting the toes. Maybe your toes don't grip the ground quite the way they used to when you're walking on sand or an uneven surface. Maybe you've noticed your shoes fitting differently because your toes aren't curling and gripping naturally the way they once did, or you catch your toe on a rug or a step slightly more often than you used to. Balance changes that begin in the feet. Have you felt a little less steady getting out of bed in the dark, or noticed you need to look down at your feet more than you used to just to feel confident walking across a room? Balance actually depends heavily on the sensory information your feet send to your brain about the surface beneath you, so when that information becomes unreliable, your balance can shift in ways that feel confusing rather than obviously connected to your feet at all. Cramping in the toes or arches, especially at night, that seems to come out of nowhere and sometimes wakes you from sleep. This is one of the signs people are most likely to blame on dehydration or low potassium, and while those things can certainly contribute, persistent nighttime cramping deserves a second look when it becomes a regular pattern rather than an occasional nuisance. Color changes. Toes that look a little pale, bluish, dusky, or unusually reddened, particularly in cooler weather, that seem to take longer than they should to return to their normal color once you warm back up. This can sometimes overlap with a separate but related circulation pattern some people with Sjogren's experience, but it's still worth tracking on its own as part of the full picture of what your toes are trying to tell you. Skin texture changes. Skin on the toes or tops of the feet becoming thinner, shinier, unusually smooth, or noticeably drier than the surrounding skin on the rest of your foot and leg. Sometimes hair that used to grow on the toes thins out or disappears entirely, which is a subtle sign that's easy to miss unless you're specifically looking for it. And this next one matters more than almost any other sign on this list. Wounds, cuts, blisters, or pressure sores on the toes or feet that are slow to heal, or that you didn't even notice forming in the first place. If your nerves are quietly not communicating information about pressure and pain the way they should, small injuries can go completely unnoticed and unattended for far longer than they ever should. This is the sign that turns a quiet nerve issue into something with real consequences if it's missed, which is exactly why the daily foot check I'll walk you through later in this video matters so much. If even 2 or 3 of these sound like your life over the past year, I want you to know something clearly. You are not imagining this. You are not being dramatic. And you have not been ignoring your body. You've simply been doing what all of us do, explaining away small signals because none of them, on their own, seemed like a big enough deal to bring up at an appointment that's already crowded with other concerns. This is what I sometimes call the sicker gap, the space between when symptoms first whisper and when they are finally taken seriously and given a name. With eyes and mouth dryness, most people eventually connect the dots, because dryness is the symptom Sjogrens is famous for. With nerve symptoms in the toes, that gap can stretch on for years, sometimes even a decade or more, because nobody teaches us to look there first. Nobody hands you a list like this one at diagnosis. You're left to piece it together yourself, usually much later than you should have to. Let's pause here for a moment and talk about how this tends to unfold in real life, because it rarely arrives as one dramatic moment. It's almost always a slow accumulation of small, forgettable details. Maybe 18 months ago you noticed your toes felt a little tingly after a long car ride, and you assumed you'd simply sat wrong. A few months after that, you noticed your feet felt colder than your partner's, even in the same room, and you joked about it rather than mentioning it to anyone. Then maybe you stubbed your toe on a doorframe and didn't feel it the way you expected to, and you brushed that off too, because nothing was bleeding and nothing seemed urgent. Individually, none of these moments feel like enough to bring to a doctor. Collectively, over 18 months or 2 years, they tell a much clearer story. This is precisely why keeping any kind of record, even a mental one, matters so much. Our brains are wonderful at explaining away isolated incidents and terrible at noticing slow accumulation without help. I also want to touch on how these nerve changes tend to connect to other things you may already be experiencing with Sjogren's, because very few symptoms in this disease live in isolation. Many people who notice early toe symptoms are also managing dry eyes, dry mouth, joint discomfort, and a kind of fatigue that doesn't fully lift with rest. These things can feel like a scattered, unrelated pile of complaints when you're the one living with them day to day. But from the inside of this disease, they're often connected threads of the same underlying immune activity, simply showing up in different tissues. Your eyes and mouth show you the moisture side of Sjogren's. Your toes may be showing you the nerve side. Neither one is more or less real than the other, and both deserve the same level of attention. Let's clear up a few myths while we are here, because I think they're part of why this gap exists in the first place. The first myth is that tingling and numbness in the feet are just a normal part of getting older. Age can bring changes to circulation and skin sensitivity, that part is true, but genuine nerve fiber changes are not simply a background hum of aging that everyone should expect and accept without question. The second myth is that neuropathy only happens to people with diabetes. Diabetes is one of the most common causes of peripheral nerve involvement, yes, but autoimmune conditions like Sjogren's are increasingly recognized as their own distinct cause, completely separate from blood sugar. The third myth is that if a nerve test comes back clean, nothing is wrong. As I mentioned earlier, small fiber involvement can hide from standard testing in its earliest stages, which means a clean test does not automatically mean a clean bill of health for your nerves. It means the bigger wires are fine. It doesn't always speak for the smallest ones. Let's also talk briefly about how this might actually get evaluated, because understanding the process ahead of time can make the whole idea feel far less intimidating. If you bring these symptoms up with your care provider, they may start with a basic sensory exam right there in the room, checking whether you can feel a light touch, a temperature change, or a gentle vibration in your toes. This alone can reveal a surprising amount. Beyond that, there are more specialized tools that exist specifically for small fiber concerns, including a small skin biopsy that looks at the density of nerve fibers in the skin itself, and quantitative sensory testing, which measures your ability to detect small changes in temperature and vibration in a controlled way. Neither of these needs to feel frightening. They are simply tools designed to see what the naked eye and a basic exam sometimes can't. Not every person will need every test, and your care team will help determine what's appropriate for your specific situation. But knowing these options exist can make bringing up your symptoms feel a lot less like a shot in the dark and a lot more like the first step of a process that has a clear next move. Now, why does Sjogren specifically go after these small nerve fibers in some people? The honest answer is that researchers are still working to fully understand every mechanism at play, but the pattern that keeps showing up involves inflammation around small blood vessels that feed the nerves, along with immune activity that can directly irritate nerve fiber endings themselves. When those tiny blood vessels become inflamed, the nerves they're supposed to nourish don't get what they need to function properly, almost like a garden that isn't getting consistent water. The nerve doesn't die overnight. It struggles, it sends confused signals, and over time, if the inflammation continues unaddressed, it can become more significantly affected. This is exactly why early attention matters so much. You're not trying to reverse permanent damage. You're trying to protect nerves that are currently in a struggling but recoverable stage. Let's talk about the emotional side of this for a moment, because I don't think enough health content actually does. If you've read through this list and recognized yourself in several of these signs, you might be feeling a mix of things right now. Maybe relief, because finally something makes sense. Maybe frustration, because you brought up tired feet to a doctor 2 years ago and it got waved off as nothing. Maybe a little bit of fear, wondering what this means for your future. All of those feelings are valid, and none of them mean you're overreacting. Recognizing a pattern in your body that has been quietly present for a long time is not dramatic. It's observant. It's exactly the kind of attentiveness that leads to better outcomes down the road. Here's the hopeful part, and I mean this sincerely, not as a throwaway line to soften the difficult parts. Recognizing these signs early is one of the most empowering things you can do for your long-term mobility and independence. This is not a countdown to something scary. Early recognition gives you and your care team the chance to investigate what's happening, track it over time, rule out other contributing causes, and take steps that may help slow progression before nerve changes become more significant. Nerve health is not all or nothing. It exists on a spectrum, and where you are on that spectrum today is not necessarily where you'll be in 5 years, especially if you start paying attention now. I also want to acknowledge something that doesn't get said enough in health content like this. It's completely normal to feel a strange sense of grief when you realize a part of your body isn't communicating with you the way it used to. Your feet have carried you your entire life without asking for much attention in return. Realizing they may need a little extra care and awareness now can feel like a small loss, even while you're grateful to have caught it early. You're allowed to feel both things at once. Gratitude for catching it, and a quiet sadness that it needed catching in the first place. That's a completely human response, and it doesn't mean you're handling this wrong. So what can you actually do starting today? Let's go through this practically, step by step, the way I'd want someone to walk me through it if I were sitting where you are. Perform a simple daily foot and toe check. This takes less than a minute and it might be the single most protective habit on this entire list. Look at the tops and bottoms of your feet, between each toe, and around your nails. Look for color changes, dryness, cracks, blisters, or any wound that isn't healing as expected. If your eyesight makes this difficult, a small hand mirror placed on the floor works well, or ask someone you trust to take a quick look for you. The goal isn't to become anxious about your feet. The goal is to know what normal looks like for you, so you notice quickly when something isn't. Wear properly fitted, supportive footwear, both indoors and outdoors. Shoes that are too tight can create pressure points you might not feel if sensation has already changed, and shoes that are too loose can cause friction and blisters you also might not notice forming. If you've been wearing the same shoe size for years without rechecking it, it might be worth having your feet measured again, since foot shape and size can shift over time. If you also manage blood sugar concerns for any reason, keeping levels well controlled matters here too, since elevated blood sugar can compound nerve stress on top of whatever autoimmune-related nerve involvement may already be present. These two things aren't mutually exclusive. It's entirely possible to have more than one contributing factor working against your nerve health at the same time, which is exactly why a thorough conversation with your care team matters rather than assuming only one cause could be at play. Stay physically active within whatever limits feel right for your body on any given day. Gentle, consistent movement, whether that's walking, swimming, cycling, or stretching, supports circulation and nerve health far more than we tend to give it credit for. You don't need to push through pain or exhaustion to get benefit here. Consistency matters more than intensity. Bring new symptoms to your healthcare provider promptly, even ones that feel minor, embarrassing, or silly to mention. A tingling toe is a completely valid reason to start a conversation. You are not wasting anyone's time by bringing up something that seems small. Small things are exactly what early detection is built on. Keep up with regular follow-up appointments, even during periods when you're feeling relatively stable and symptom-free. Nerve changes can be gradual and easy to miss in the moment, which is exactly why consistent check-ins, rather than only showing up when something feels urgent, are how subtle shifts get caught early rather than late. Consider keeping a simple symptom log, even something as basic as a note on your phone, tracking when tingling, numbness, or color changes happen and under what circumstances. Patterns that feel invisible day to day often become obvious once you look back at 2 or 3 weeks of notes side by side. This kind of record can also be incredibly useful to bring to an appointment, since it's much easier to describe a pattern than to try to remember individual moments months after they happened. Now, there are certain signs that should never wait for a routine appointment, and I want to be very clear and direct about these, because urgency here genuinely matters. If you experience rapidly worsening weakness in your foot or leg over the course of hours or days, a sudden and significant loss of sensation that wasn't there before, severe balance problems that put you at real risk of falling, or any foot wound that shows signs of infection, spreading redness, warmth, swelling, or simply will not heal despite basic care, please seek medical attention promptly rather than waiting to see if it resolves on its own. These are the moments where a delay could allow something to progress further than it needs to, and reaching out quickly is always the right call. There is no such thing as being too cautious when it comes to a wound on a foot that may not be sensing pain the way it should. I also want to gently mention that if you ever notice sudden changes affecting both feet very rapidly, or symptoms that seem to be climbing upward from your feet toward your ankles or lower legs over a short period of time, that pattern deserves prompt medical attention as well, simply because rapid, ascending changes are the kind of pattern that benefits most from being evaluated sooner rather than later. One more practical piece worth mentioning, since it comes up so often in questions from people watching videos like this one. Temperature protection matters more than people realize once sensation has started to shift. If you can no longer reliably feel whether water or a heating pad is too hot, it's worth testing water temperature with your wrist or the back of your hand instead of your foot, and being cautious with heating pads or hot water bottles directly against the skin of your feet, since a burn can happen without the usual warning signal of pain to stop you in time. This isn't meant to scare you away from warmth and comfort. It's simply about finding safer ways to enjoy that warmth once your feet may not be giving you the same early warning they once did. It's also worth mentioning that trimming toenails carefully, or having them trimmed professionally if reaching them has become difficult, is more important than it might seem. Small nicks near the nail bed that would normally be felt and noticed immediately can go unnoticed if sensation has changed, and combined with slower healing, even a small nick deserves a little extra attention until it's fully closed. Let's come back to something calmer for a moment, because I don't want the last thing you take away from this to be worry. I want it to be clarity, and I want it to be hope. So many people living with Sjogrens go on to live full, active, independent lives, walking the dog every morning, dancing at a grandchild's wedding, gardening on a Saturday, taking long walks along the water just because it feels good to move. Paying attention to these quiet signals in your toes today is not about fear of some distant future. It's about protecting the version of you 5 years from now, 10 years from now, the one who still gets to move through the world exactly the way she wants to, on her own 2 feet, quite literally. I also want to remind you that noticing these symptoms does not mean your situation is severe, or that anything drastic is guaranteed to happen. Plenty of people notice early signs like these, bring them up with their care team, get evaluated, and make small adjustments that help them feel more in control, more informed, and more at ease, not less. Knowledge in this case really is protective, not just symbolically, but practically. The earlier something is on your radar, the more options you and your care team have for addressing it. Here's a simple way to build the daily toe check into your routine so it doesn't feel like one more task on an already long list. Do it right after you take your socks off at night, or right before you put them on in the morning, since you're already looking at your feet in that moment anyway. Spend 15 seconds looking. Spend 15 seconds feeling with your fingertips for texture, temperature, and any areas that feel different from the rest. That's it. 30 seconds, fold it into something you're already doing, that could genuinely make a meaningful difference in catching something early rather than late. If any of these signs felt a little too familiar today, if you found yourself nodding along or thinking, wait, that's happened to me, I want you to comment the word symptom map below this video. When you do, I'll send you the link to the full Sjogren symptom map and diagnostic action plan, so you can start connecting these dots for yourself with a clear next step already in hand, rather than trying to figure out where to even begin on your own. And if something about this video felt like it was speaking directly to a part of your life you've been quietly wondering about, that feeling of things finally clicking into place, comment the word tangled, because that tangled, hard to untangle feeling is exactly what we're here to help sort through, one video at a time. If you've already downloaded the symptom map before and this connects to something you're working through in a different part of your file, so to speak, comment the word file and I'll make sure you're pointed toward the resources that build on what you already have. Before you go, I want you to do one thing for me right now, not later, not tomorrow, right now if you can. Take 30 seconds and really look at your toes. Notice the color. Notice the temperature. Notice whether anything feels different from what you remember. Make this a habit tonight, and then again tomorrow night, and let it become as automatic as brushing your teeth. Your future mobility may quite literally depend on a habit this small and this simple. And if you know someone else living with Sjogrens who has been brushing off tingling toes, cold feet, or the occasional cramp as just getting older, please send them this video. It might be the nudge that helps them notice something a little sooner than they would have on their own, and that small nudge could genuinely help protect their independence for years to come. That's what this channel is here for. Connecting quiet clues to the bigger picture, one symptom at a time, so nothing important stays hidden for longer than it has to. I want to close with one more thought, because I think it matters just as much as anything else in this video. There is a real difference between vigilance and anxiety, and I want you to walk away tonight practicing the first one, not the second. Vigilance looks like a calm 30-second habit, done the same way every day, without drama attached to it. Anxiety looks like checking your feet 5 times a day, spiraling over every small sensation, and losing sleep over symptoms that haven't actually changed. If you notice yourself sliding toward that second version, it's completely okay to step back, take a breath, and remind yourself that awareness is the goal here, not fear. You are allowed to hold this information with a steady hand. I also want to say this clearly, because I think it gets lost sometimes in health content that leans too hard into worst-case scenarios. Most people who notice early signs like the ones covered in this video go on to have long, stable stretches where nothing dramatic happens at all. Catching something early very often means exactly that, an early catch, followed by simple monitoring, followed by years of life continuing much the way it always has, just with a little more awareness folded into your daily routine. That is genuinely the most common outcome, and it deserves to be said out loud instead of left as an afterthought. If you found this video helpful, consider staying subscribed, because this channel exists to keep connecting these quiet, easy to miss clues across every part of the body Sjogrens tends to touch. Nerve symptoms today, something else entirely next time, always with the same goal in mind, helping you notice patterns sooner rather than later, so you're never left piecing things together alone the way so many of us have had to in the past. One last thing before you go. If you've been putting off a conversation with your care team about any of the symptoms covered in this video because it felt too small to bring up, let this be the sign that gives you permission to bring it up anyway. You don't need a dramatic symptom to justify asking a question about your own body. Curiosity about your own health is never something you need to earn the right to have. It's simply part of taking care of yourself the same way you take care of anyone else you love. Thank you for spending this time with your own body today. That kind of attention is never wasted. I'll see you in the next one.